I was first diagnosed when I was 13. Was playing basketball, had pulled my hamstring, had a little bit of a bump on my lower back. We eventually went and got x-rays and did all that and found that there was a mass on my pelvis bone.
I got a phone call from his doctor, and yeah, that was the worst phone call any mother would ever want to get. And so, you know, all she said was, get Robert and get down to Rainbow and meet the oncology team. It's the worst news any parent ever wants to hear, ever, that your child has cancer.
My parents came in my room and just sat at the foot of my bed and said, Robert, you have cancer. I was still very young. I was 14.
You can imagine for a 14-year-old, 15-year-old boy to be confined in a hospital bed when the rest of his colleagues and classmates are out doing what a 15-year-old should be doing. You can imagine the disease doesn't just affect his body. This is a disease that affects the mind and the soul of a child who is growing up to be an adult.
One of the things that we've observed is that the cure rate in the adolescent young adult cancer population is actually lower than it should be.
Over the last 30 years, there has not been any improvement in the outcome for adolescents and young adults with cancer. The good news is that we've established the Angie Fowler Adolescent and Young Adult Cancer Institute to deal with that challenge.
At university hospitals, we collaborate in so many ways, but importantly, in the area of childhood and young adult cancers. Both Rainbow Babies and Children's Hospital and the Seidman Cancer Center come together in a very unique way in order to heal, to teach, and to discover, and to find new cures that will assist children all across the world in being cured from cancer.
When I was first diagnosed, I was 13. When the cancer kind of came back, I really wanted to be in a more adult environment. Going through treatment over at Seidman in the young adult area, and then going to the Angie Fowler Institute was really neat to see, was really comforting that they are trying to get a facility for young adult patients that they can kind of go and feel their age and be independent and feel comfortable.
When Justine has to be in the hospital for any of her chemotherapy, she would be admitted. Our pediatric oncologist, who knows her cancer and the right approach, will co-manage her care with our physicians in the Seidman Cancer Center.
First, Robert was going to be a teacher, and then right before the end of the school year, he said, you know, Mom, on my way to school today, I decided I'm going to change.
Robert is working with me now. My hope is that one day he will take over my job and find a cure for cancer for others that come after him.
When I was going through my treatment, I actually was given a clinical trial, a type of chemotherapy, and that was incredibly successful for me. And I saw a very concrete result in these research studies, and I saw how effective they could be firsthand. I've now come to realize that the connection is here right within university hospitals.
We need to know why this happens and to make sure that it doesn't happen to anybody else and nobody has to go through what my family and I had to go through.
In this time and age where the funding from the National Cancer Institute is dropping, and it's dropping disproportionately more in research fundings going into adolescent young adult cancer, I think this is not the time for us to back up and back off.
At Rainbow and Seidman, we really have put together the team that allows us to be at the forefront. In fact, we're educating people nationally and internationally about doing this in a coordinated fashion so we can help our patients, both through our research and our patient care. We're in a unique position, and I think in many ways, we're leading the nation.
I'm on the pre-med path. I'm an undergraduate student at Miami University. I'm a junior right now. And I'm just really looking forward to the future.
My treatment's done. I've started a new job. I've gone back to school, and I just feel terrific.
Robert and Justine's stories are two wonderful examples of the power of hope and healing. They have benefited directly from the extraordinary generosity of people in our community, like Shar and Chuck Fowler and their entire family, and Jane and Lee Seidman, who together have created life-affirming environments within Rainbow and the Seidman Cancer Center. The generosity of Iris Wolstein creating programs like Kids Kicking Cancer is teaching the benefits of nutrition and exercise, ensuring the best quality of life and outcomes, preparing all of our patients for life after cancer. Every one of our patients, whether they're young teenagers or in their early 20s, represent our future. They'll be responsible for our health care. The discoveries that they make will determine our outcomes as patients in the future. They'll be educating our children and are going to be such an important part of our society. I can't think of a better place to invest our time, our talent, and our resources.
I know whatever Robert chooses is going to be the right thing. He's going to be an inspiration to this world. There's a reason he's still here. I'm convinced.